Hi everyone, welcome back to my YouTube channel, and today we are going to talk about Fordyce granules. So let's start our topic with introduction. Fordyce granules are common benign anatomical variations that are seen in oral cavity. They appear as small, pale or yellowish spot and represent ectopic sebaceous glands. They are not considered a disease but rather a normal variation. Definition of Fordyce granules. Fordyce granules are defined as ectopic sebaceous gland located on the oral mucosa, most commonly on the buccal mucosa and lips. Etiology of Fordyce granules. They are developmental in origin. They result from misplaced sebaceous gland during embryogenesis. They are not associated with infection, systemic disease, or poor oral hygiene. Pathogenesis of Fordyce granules. Sebaceous glands normally occur in the skin associated with hair follicles. In Fordyce granules, these glands are located in the oral mucosa without hair follicles and secrete sebum directly into the mucosal surface. Clinical features of Fordyce granules. They appear as small, discrete, yellowish or whitish papules. They are commonly found on buccal mucosa, vermilion border of lips, and retromolar area. They are usually asymptomatic and discovered incidentally. They may appear singly or in clusters. Age and gender distribution of Fordyce granules. They are more commonly seen in adults than children. There is no significant gender predilection. Prevalence increases with age. Differential diagnosis of Fordyce granules. Fordyce granules should be distinguished from candidiasis, that are the white patches, leukoplakia, that are also white lesion with malignant potential, and they should be distinguished from lichen planus, that are radical white striations, and other mucosal lesions. Diagnosis of Fordyce granules. First we do is clinical examination, that is usually sufficient, and no biopsy is required unless the appearance is atypical. Histology show sebaceous gland in the lamina propria if done. Clinical significance of Fordyce granules. They are harmless and do not require treatment. They are important to recognize to avoid misdiagnosis as pathological lesions. They may cause cosmetic concerns in some patients. Management of Fordyce granules. No treatment is necessary for them. Patient reassurance is the main approach. And cosmetic removal by laser therapy and micropunch technique may be considered in rare cases if patient is concerned. Conclusion of this lecture video. Fordyce granules are benign ectopic sebaceous gland that are commonly seen in oral cavity. They have no pathological significance but are important to recognize clinically to avoid unnecessary treatment or patient anxiety. And this was all about Fordyce granules. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.